I'm here because I recently visited Putney Mead GP surgery in my constituency. It's a really large surgery serving 25,500 people with 23 GPs, and they know what they're talking about. It's an excellent facility. But I spoke to the doctors about the issues they're facing, and I said, what are the main issues? And they said the main issue is childhood obesity, and that's what I want to focus on today. They're worried about the current state of the NHS being able to provide services to support childhood obesity, but also about the lack of services for primary school children, where early intervention is very, very important in tackling childhood obesity. But also they're very concerned about continuing education. And then they say that they talk about the provision that there are provided by Wandsworth Council for primary school children, but that ends at year 6. And so in secondary school, there's even less provision and support for tackling obesity. And they identified that as a key issue. Today, 2 in every 5 children in England are overweight or obese by the time they finish primary school. And this has lasting consequences for physical health, for mental health, for the quality of their life. The National Child Measurement Programme found in 2021 to 22 that 10% of reception-age children in England were obese. And the proportions were higher amongst year 6 children, with 23.4% being obese. So something is going wrong in our provision and support programmes for primary school children. But childhood obesity is a significant concern in my borough of Wandsworth, where over 1/5 of children in reception are overweight or living with obesity. And this figure rises to 37.7% of children in year 6, which is higher than the rest of the country. Wandsworth Council does have several programmes to tackle this. The Health for Life team runs the Mums, Minis and Kickstart programmes for primary school-aged children and their families. And the Children's School Food Strategy and the campaign targeting takeaways near secondary schools are all having an impact. But this needs to be amplified and supported by the same programmes across the country as well. And, as I said, it needs to be maintained. There needs to be a continuity of this support into secondary education as well as primary. Because in the United Kingdom, the prevalence of obesity amongst year 10 children is still 23.4%. So you're still seeing 1 in 4 children are being classified as obese. And in London, that is still 37.4% of year 10 children. So it's essential to continue promoting healthy lifestyles, but there needs to be some other significant infrastructure issues as well. One is an issue about planning. It's about having shops with healthy produce in the right places and easier to access for people who don't have the same amount of transport options. It's about also tackling takeaways near secondary schools, which Wandsworth Council is starting to do, and there are some elements of good practice that can be learnt. Also tackling inactivity in schools, with many playing fields having been sold off, has meant a reduction in access to physical education, to PE classes in school. I've seen that for my own children who've gone through secondary school with significantly less access to PE lessons than I had when I was going through school. Also healthy eating and teaching cookery. I'd like to pay tribute to a great community organisation in my constituency called Bags of Taste, who teach how to eat better for less. And they have a really high take-up, and for those who do take them up, they really enjoy making the kind of food they would get from a takeaway, but that they can cook for less money in their own homes. And those are to be really applauded and supported. Also, there can be much more action taken by supermarkets and action on advertising of unhealthy food. And another excellent programme that I've seen really working but isn't taken up comprehensively enough is the Daily Mile, which started off with a school in Scotland, I think in Stirling, and has been taken up by many primary schools around the country and is tackling this and making a difference. To conclude, Mr Dowd, Labour will tackle childhood obesity with a range of measures, including implementing the 9 p.m. watershed for junk food advertising, getting kids moving with a mandatory national curriculum with more of a wide range of physical activities, free breakfast clubs in every primary school, and taking action to end the promotion of junk foods targeted at children. So we will take action. The current obesity figures are a damning indictment of 14 years of Tory rule which haven't worked. It's time for Labour.